Tom, you can start talking, okay?
Okay, you let me know. Thanks.
Yep. And you can begin.
Good afternoon, everyone, and welcome to today's UFCW 21 Town Hall phone call. We have some folks on the line that are here to discuss your rights as healthcare workers when it comes to treating patients with the Ebola virus and the need for all of us to have proper safety and training and staffing in our workplaces. Today we'll be able to hear from some of these folks and take questions from you as our members during the call. To ask a question during the call, simply press 0 on your phone and on your phone keypad, and that way you'll be connected directly to one of our operators, able to get you on the line and ask your question. So again, any of the members on the line today, welcome to UFCW 21's Town Hall to discuss the Ebola virus and other proper safety and training and staffing issues in healthcare workplaces. We have hundreds and hundreds of members, thousands now joining the call, which is great. Welcome, everyone. And we're going to get going here in just a second. So, again, reminding you that during the call, just press 0 if you have a question that you'd like us to answer. To get things started, I'd like to have Dave Schmitz, President of UFCW 21, take the mic. Dave, go ahead.
Hi, everybody. This is Dave Schmitz, President of UFCW 21. We have over 17,000 healthcare members around the state who provide care at hospitals, clinics, and other healthcare settings, and our members include nurses, professional technical service, and support staff. So due to the Ebola crisis situation, we've been working in concert with our international union and all the other healthcare unions in this state to make sure that necessary safeguards and your rights at work are clear to all healthcare workers and to protect our members as well as our patients and the community. All of the unions have sent out information requests to our healthcare employers asking what their specific training, staffing, equipment, and information plans are for handling a potential Ebola patient. We're now getting that information back employer by employer and reviewing it. If you haven't seen a sample copy of the request, you can go to our website at www.ufcw21.org. We're holding this town hall today to provide more specific information, and I want to introduce two people that are with us on the line today. One is Robin Robbins, who's the Director of the Occupational Health and Safety Office of the UFCW International Union, and we're also joined by Lisa Brasso, a doctor and certified industrial hygienist. Dr. Brasso received her master's and doctoral degrees in industrial hygiene from the Harvard School of Public Health, and she is a faculty member at the University of Illinois at Chicago. So welcome, everybody.
And so again, before we have Dr. Brasso take the mic, I just wanted to remind we continue to have members joining the call, over 2,000 now on the call, so it's great to have everybody joining us today for the call. I just want to remind all the participants, you just need to press 0 during the call. If you have a question that you'd like to be answered, press 0. That will connect you with an operator, and then we'll be able to get you on the call. And if we aren't able to answer your call today, you will be able to make a recording of that question at the end of this call, and we'll get back to you. So let's go ahead with the introductory remarks. Lisa, why don't you go ahead with some introductory comments, please?
Sure. First of all, let me say thank you for being invited to talk with everyone, and I am equally interested and concerned about healthcare worker protection for this particular organism and disease, and I hope that I can be helpful. I do have to admit that I'm probably going to say I don't know more than you would like me to, but I think that's going to be the theme, or that should be the theme, is that there's a lot that's not clearly known about this particular organism and disease. So I just want to say three things, and The three things are that I think it's important to understand and have the right paradigm when thinking about disease transmission. And my publications on the CIDRAP, as a commentary on the CIDRAP website, and the media interviews that I've been having, and other publications have all focused on the fact that the current infection control paradigm is not appropriate. It's not appropriate for any disease, but in particular, it neglects one very important piece of exposure, which is the possibility of inhaling small particles when you're standing near someone where there is an aerosol. So I call that aerosol transmission. And I can talk a little more about that if people would like more details. But essentially, my interest is in assuring that healthcare workers are protected when they can be exposed to aerosols and infectious aerosols in particular during their work. And I'm very concerned that there's several factors that could contribute to aerosol exposure and disease for this organism. But I will tell you, no one really knows what the modes of transmission are. We conjecture from risk factors. So that's the first thing I want to say. The second thing I want to say is that we should all expect in healthcare settings that everyone is at the table making decisions, good decisions about personal protection. So when I say everyone, I mean that there should be infection control people, there should be occupational health and safety people, and there should be those who represent workers. And that if you don't have all of those people together making good decisions, then you don't end up with good protection for workers. And that's, I think, what we are seeing is that only one or two of those professions has been making decisions, and the people who have the knowledge about occupational health and safety and worker safety and personal protection have not been at the table. So I'd like to encourage you to encourage your organizations, your professional organizations, and everyone else you can think of to make sure that your occupational health and safety professionals are at the table and that you're there too. And the third thing I'd like to say, and this is in the context of personal protective equipment, I've been working on respirators for most of my life, at least my professional life, but it is not as gratifying to work in this area if that's all we rely on. And when I say that, what I mean is I would like us to be talking more about the hierarchy of controls, and this is a principle we use in industrial hygiene. The hierarchy of controls requires that you think about using things that either eliminate or substitute or remove or isolate the hazard, meaning we work on trying to eliminate or prevent exposure to the hazard and control at the source. Now, the source being a person, in the case of healthcare, that isn't always easy, but there are lots of things we could be doing in the context of this particular outbreak and many other situations with infectious disease as well that would eliminate the need for a lot of personal protective equipment, or better yet, would eliminate the number of people who would have to wear personal protective equipment. And by that I mean if we were to, so this decision to identify a small number of target hospitals as the locations where most of the healthcare will take place is a good example of using the hierarchy of controls, because then you've limited the number of people who will have high risk and high exposure to Ebola patients. And you can assure that you put your resources to protecting those people. Triage on the phone, triage in a limited and controlled setting. All of those are good examples of the higher levels of the hierarchy of controls. The use of personal protective equipment is at the bottom of the hierarchy of controls. It asks people to take responsibility for their own personal protection and be sure they're wearing their personal protection correctly, putting it on, taking it off correctly, that they know that it fits well. This is a lot of responsibility, and I don't think that it's entirely fair to expect workers to be the only ones responsible for protecting themselves from hazards, particularly something as hazardous as Ebola, which is a risk group 4 organism. So I want to encourage you to encourage your organizations to use and think about all the hierarchy of controls and moving all their decision-making up towards the top of the hierarchy of controls before they turn to personal protective equipment. I'm not saying it isn't necessary to use personal protective equipment. I'm saying it shouldn't be the only thing that people use. That's pretty much all I wanted to say.
Thank you for those comments, Lisa, and Robin will be available as questions come up specifically. One thing that we want to do is allow for the members that are on the call to participate. One way that everyone can participate in the call is right now we're going to go to our first poll question to get at the question of, do you feel like you and your coworkers have gotten adequate training for the appropriate procedures for handling an Ebola patient should one come into your facility? It's a question that we've gotten concerns from members across the state on, so we're trying to get a bead on that question. So please press 1 if you do feel like you've received adequate training, and please press 2 if no. And I'll get back to you with the answers to that response in just a moment. We're going to go to our first caller, and we have Samuel on the line. Samuel, go ahead with your question.
Yes, I'm Sam Williams. I'm at Valley Medical Center. I work in the radiology department, and it's, I work in emergency room, downstairs, outpatients as well, and I'm seeing the nurses getting adequate training on the PPEs, even though we learned it in school and things, but we haven't got taught since this Ebola epidemic. And I'm just, wondering, has other radiology technologists got adequate training, or, I just feel like we bottom feeders, like they really don't care about us. I know I don't feel like one, but it's just the way that I'm being treated like, And we could be in contact with these patients if we go in the room and they slide past the nurse administration. We are right there.
And Robin, maybe you could, thank you, Sam, for that question. Robin, maybe you could address part of it, and Lisa jump in too, but this question of, do healthcare workers more universally, what rights do they have to be able to demand safety training in their workplaces, not just nurses?
Robin, do you want me to take that? No. I'm not hearing her.
She may have, yeah, go ahead, Lisa. She
Maybe
may have
muted.
I was on mute. Oh, no, I was on mute. Okay. Sorry. Okay, I have to remember to unmute. So thank you for the question, and I'll just briefly address it and turn it over to Lisa. I did want to say thank you for inviting me to be on the call. I work out of Washington, D.C. at the International Union, UFCW, Safety and Health Office. In general, healthcare worker, your employer is required to do an assessment to determine who either is exposed, or the important word is potentially exposed to these hazards. So you said you worked in radiology, but also in the emergency room. You therefore would be assessed by your employer as potentially exposed, which gives the employer a responsibility here to provide you with training and to ensure that you're protected. So that could be, that certainly would be training on the hazards. The hazard in this case is potential exposure to Ebola. And then in addition, whatever appropriate PPE is going to be required in all the different aspects of that personal protective equipment. So you need to consider you and your coworkers in the realm of who is potentially exposed, and that is the OSHA requirement. It's exposure and potential exposure. And then I will turn it over to Lisa now.
Lisa, did you have anything to add to that?
No, I was going to say the same thing. They need to do a risk assessment, and they need to tell people who's in the high-risk categories.
Yeah, this is Dave. Oh, I'm sorry, Robin.
I was just going to add, Dave, that, if you the union, you have a right to speak up about this as well, and you certainly ought to. And when you speak up about, your concerns, you are protected in that right to raise your concerns about these issues.
Yeah. So for Sam and other members, you have rights under the union contract and under the law to bring these kinds of questions up. I think just to tail on the follow up on the point you made, Sam, there's been a lot of attention around nurses, particularly because of what happened in Texas. But it's very important, and we are certainly, as part of our information request, anybody that can potentially be in this situation, from nurses to you to housekeepers, has to have the proper training. And that is why when in our information request, it is aimed at anyone who could be put in this sort of position.
And the information request that Dave's referring to there, again, he mentioned at the beginning of the call, those are information requests that the union, our union, has sent to all of the various employers around the state. And a sample of that is up on the homepage of our website, just one click away if you want to download a PDF of that. Just to remind people, if you do want to ask a question, press 0 and we'll get you connected to an operator. The results of that initial poll that we did, 93% of you, 93% do not feel like you have received, or your coworkers have received adequate training and for appropriate procedures. That's, I think, why many of you are on the call today, and part of the anxiety that many people are feeling in healthcare and in our communities. So that's what we're doing, is trying to get this educated, get the information requests out there, and get training put in place. Let's go to another caller. Let's go to Emily at Group Health. Emily.
Yes, hi. Can you hear me?
Hi. Yes, we can. Go ahead.
Hi. I'm a phlebotomist, and I work at Group Health at Tacoma. And my question was, she said that the transmission was aerosol transmission. What is the difference between aerosol transmission and airborne transmission?
Thanks for that question. There were several members that had a similar question online, so this answer would address that. Lisa, go ahead and grab that, please.
Sure. Thank you for asking that. So the CDC has an infection control paradigm where they talk about droplets and airborne. And droplets, I think, if I understand correctly, their paradigm, it's big particles, spray particles that are propelled, through coughing or sneezing or something, and they're propelled directly onto your face, into your eyes, into your mouth, into your nose. Airborne means that you're exposed to particles in the air, infectious particles in the air, but you have to be further away. You have to be away from the source. So it's generally assumed that you're at a distance. And I don't know exactly what that distance is, but they often say greater than 3 feet away. And that if you inhale those particles and get disease, then that's an airborne disease. The most common example of an airborne disease, or the most well-known, at least in healthcare settings, is tuberculosis. But why I use the word aerosol is because when someone coughs or sneezes, or you do an aerosol generating procedure like intubation, vomiting, diarrhea, lots of those things, they cause aerosols. And an aerosol actually consists of a wide range of particle sizes. Some are large, some are very large, and some are small. And they get distributed into a room fairly rapidly. And you can actually breathe the small particles when you're standing nearby, not just at a distance. And so there's inhalation that can happen both near to a source of a patient or far away from a source. And the paradigm, the infection control paradigm, does not recognize the breathing in, the inhalation of small particles near a source as a way of as a mode of transmission of disease. I don't exactly know why that is, but I think it's because it's based, I conjecture that it is based on, the paradigm's based on a very very old set of data and a very outmoded understanding of particles and aerosols that comes from like the 1930s and 1940s. And we've been studying aerosols for many years, and we now call them aerosols, and it's the right word to use. Airborne and droplets is not. And so when I talk about aerosols, I'm talking about an exposure to a suspension of particles in the air, some of which are large, some of which are small. And that's my definition. And I use aerosol exposure to describe both near and far away exposure to particles in the air. What the difference is for Ebola, for example, is, and the reason I don't think that there's airborne transmission using the infection control paradigm, meaning exposure and inhalation at a distance, is that Ebola is not, it does appear to be viable in air for some period of time, but it's not very long. It's about there's only a few experiments, and they've shown that it's about an hour and a half at the most that an organism would stay alive or viable in the air, and that's not very long in comparison to tuberculosis. That organism stays alive for a very, very long time in air. It's very hardy. It survives very well in air, and that's why tuberculosis can cause disease if you inhale it at a distance, because it's still viable. But I don't think, we conjecture that Ebola will not be at some distance away. But we do conjecture that if you get a fairly high dose by inhalation standing nearby, that there is some chance that disease could be transmitted. And I'll add the important second feature of why we conjecture this is that the lungs. So there are receptor cells specifically for that Ebola particularly targets. It's our immune cells, and there are macrophages and dendritic cells and other cells like that, but they're largely our immune cells. And those cells are found throughout the epithelial tissue, which is in our lungs, in our GI tract, in our nose, and all of those. So even if it does not cause a respiratory disease per se, it causes a systemic disease. It's a disease that, it's an infection everywhere in your body. Really, it's all of your immune cells eventually. But it has to start somewhere, and we conjecture, my colleague and I, that because there are receptors in the lungs, that if you breathe in particles, they land in your lungs and they target those receptor cells, the infection could start there, because then all it takes is to start in one place and move to another to start the chain of infection that leads to the disease. So,
Lisa,
those are the key features of why we argue aerosol transmission.
very good. Thank you, Lisa, and thanks for quite a few folks had questions similar to that, which I'm glad we're able to address. We're going to get to Anna Hubert in just a sec. I want to ask another poll question. It's just really helpful to hear members' survey feedback on this stuff when we have so many of you on the line. On the second poll question, again, you're just going to use your keypad to answer this. Do you think that you and your coworkers have a voice with your employer when it comes to putting in proper procedures and protocols? Do you feel like you currently have a voice? For that, press 1 for yes and press 2 for no. And we'll get back to you with the results of that in just a second. Let's, again, Anna at Auburn Medical, you're on the line.
Okay, my question is, I look at Providence, the hospital we have is one room for an isolation room, but it does not have an ante-room in which to put on or take off your protective wear. We go right into the hallway. How is that affecting patients and us?
Thank you. So if I understand stay on the line, Anna. So if we understand your question, it's really, if you don't really have all these extra rooms, where are you supposed to don up or don off and that sort of thing? Is that the question?
Correct.
Yes. Okay. Lisa, do you have any particular thoughts to that question?
I don't. There are requirements about negative pressure rooms in the TB guidelines, the CDC TB guidelines, and I'm not intimately familiar with those. I guess I would agree that is something I would be concerned about if you're donning and doffing your personal protective equipment in a hallway. Again, it's more just it doesn't give you the space perhaps to do it correctly, and if you have to interact with people walking by, there's the potential for transmission of infection by direct contact. And if you're covered with body fluids that are potentially infectious, that would be a concern. Again, I would say the answer to the same is the same as the previous answer, is that your organization should have done a risk assessment and should have considered the routes of transmission, and they should have a way of assuring that there will not be transmission, even if you're doing donning and doffing in the hallway.
And
I can follow up on that. Actually, OSHA has a page on its on the OSHA site, OSHA.gov. But OSHA states that the bloodborne pathogen standard does apply here, and apparently will look at hospitals' procedures of handling contaminated waste, including the protective gear that you may be wearing. And this protective gear ought to be going into labeled hazardous waste containers. So now that doesn't answer your question directly, but that does speak to the hospital's procedures of how you get out of your clothing. In addition, there are the CDC guidelines specifically talk about the safety of how safe, your procedures are in taking off the clothing. So I think I hear you saying that there is no extra space to go into to don and doff your clothing. If it's contaminated now, your hospital really needs to look at where it's being done, the procedures, the training for you, and where that clothing goes. So that might be something additional that the union could look into in terms of information requested relative to this hazard.
And Annabelle, I would just add that is an example of the kind of things that is addressed in the information request. And we are also having this issue come up directly at bargaining tables right now, for example, at Providence Everett. And so that is why the request is so important, because we have to know what they have in place. I mean, just the way you've described it, I would say at a minimum sounds quite problematic to me, based on the guidelines that we understand are supposed to be followed. So this is exactly the kind of situation that we're getting the replies from the employer, and that based on those replies and our coordination with the other unions who also represent employees at the same facilities, we may also be doing follow-up surveys with our members to verify that, one way or another, we will be talking to our members to verify that what the employer is actually saying is being done. And that is our role, is to make sure, and you're right, in having a union, to make sure that you work in a safe environment for you as a worker and for our patients and the community.
And Dave, I think that the poll results from the prior question kind of get at this a little interestingly as well, because 68% of the respondents said that they do not feel that they have a voice with their employer about this, and 32% feeling that they do. I think most folks mean by that the behavior of their employer. As we've heard time and again on this call, we do indeed have the right to have that voice at the table and in our workplaces, but the current practices right now are not what they should be.
And frankly, we have, I don't think this will be a surprise to a number of people. We have a number of employers that too often don't listen carefully to what frontline staff are saying. And that's a problem in a number of ways, and it just becomes, all the more important in a situation like this.
Let's go to Ryan at, I believe it's Providence St. Pete. Ryan, go ahead.
Well, hello and good afternoon.
Good afternoon.
Thank you
go
for
ahead.
your
Good
yes,
afternoon.
thank you for your time. Just a quick question. From the research I've come across, I was curious if anyone has been looking at the Magnet Hospital, Nebraska Medical Center biocontainment unit protocols and procedures for protective equipment.
This is Robin. I have not.
Okay.
Yeah.
This is Jenny Reed, and I guess one of the things I would like to just say here is all three of the unions have been working together and looking at the Nebraska hospital. It is one of the areas actually that they've shown some significant good practice. So we are all three of the unions, and part of the survey that we'll be putting out on the 14th of November. That is one of the things that we're looking at to make sure that we're also sharing best practice information. I don't think that answers your question directly, but wanted to let you know that we are looking at that to share that best practice information with members. Lisa?
And just for everybody's information, Jenny Reed is our healthcare director at the local.
And we're going to go to another question as well. We'll get as many of these questions in as we can. And remember, press 0 if you want to ask a question. And if we are not able to get to your question during the live call, you'll have a chance to record that question when the call is over, and we will have a staff person get back to you. Let's go to Mary Smith, I believe, up at Prov Everett. Mary, go ahead.
Yes, Providence Everett had come out right away and said they were going to accept Ebola patients, yet we had last week a little 5-minute health stream slideshow on kind of what Ebola is and that you should wear protective gear, and that's about all the education we had, and many of my coworkers felt this was very inadequate. And I wondered if the further education was going to be a national education, or if it's going to be per hospital on what they decide they are going to teach about it.
Well, I'd say a couple of things from our point of view, and then Jenny might jump in because she's bargaining the Providence nurse contract in Everett right now. One is we expect to develop sort of a uniform best practices that we expect of the employers based on best practices that are out there. And what we have heard from a number of members is responses similar to what you just said in terms of the level of training provided to date, which is clearly, I think, inadequate. Jenny, you may have something to add.
Mary, thanks for calling in, and we actually were with your bargaining team today at the bargaining table, and this came up just 2 weeks ago where we asked the employer what their plan was. We know immediately after beginning to ask those questions and sending the information requests that Providence did move pretty quickly into enacting a plan, and we're continuing today to push them to do more hands-on training specifically on donning and doffing, making sure that people know where the appropriate equipment is, talking about isolation. When people come in, how do they isolate versus moving them all over the hospital? Because of the concerns that you outlined about Providence Everett saying that they were going to be the regional center. So one of the things I would say to everybody on the call is if you have concerns about having a voice in this, most of our healthcare facilities have a conference committee and a labor management committee. This should be on every single one of our agendas. All of the healthcare facilities have also received that information request. And collectively with all the healthcare unions in Washington State, we are working together to make sure that we have best practices shared. And the best practices that we're hearing really are about just muscle memory, having people have this muscle memory go in and practice, and having a partner, having a buddy, so that you're making sure that you're understanding the appropriate procedures to keep you, your family, your community, and your patients safe in the possible chance that somebody might come in.
Yeah, and I'll just, this is Robin, I'll just add that, you know, I think that at a minimum, certainly what the key principles in this, which are in the CDC guidelines, is that it has to be repeated training, and I think that speaks to what Jenny just said, the muscle memory. So it's got to be training and repeated training, and also demonstrating competency, so that you know you feel competent, but also demonstrate the competency in the use of the personal protective equipment, as well as having the buddy there to observe what you're doing, and you know, and confirming the competency in what you're doing. So, you know, as a minimum, that should be your standard of what you should expect your employer to be providing in terms of training.
Thank you, Robin. So we are just about wrapping up on the call for this afternoon. Again, we do appreciate everybody getting on for this afternoon, and we're going to have Dave just make a few final comments. But if we weren't able to get to a question that you did have, please just stay on the line after we disconnect the call, and you'll be able to record that. And we'll have one of our staff get back to you. And obviously, please contact your union rep or your steward as questions are coming up, as this and other important workplace issues are coming up. So I'll let Dave just make a concluding comment.
Well, I appreciate everybody being in on the call. It's clear that this is still in sort of state of flux on the development of the best practices, and I appreciate the point made about hierarchy of control and who should be in on this decision making, and where emphasis should be put. And so these, it's a part of an ongoing process to make sure that our members and patients are protected. And so as we get these responses back, all the unions will be doing follow-up with our members, we'll be doing follow-up with the employers. We expect there to be certain protocols in place that provide the necessary protection, and I think we want to have, obviously we want to work with the employers to do this, but they are going to be required to work with us to make sure that we get these questions addressed. So and the proper protocol and processes in place. So I want to thank our experts for being with us today. And again, there is no way, given all of the people on the call, that we can answer every question, but please leave a question if you have one, and we will consult experts or answer it ourselves if we have the appropriate information, and we will keep everyone informed as this process moves along. So, keep your eyes open for updates in the mail or check our website. And thanks again, everyone, for being a part of this.
Thank you.